All right. Hello, all you fellow type 1s out there. Oh, wait, maybe I'm muted. Hold on. Okay. Hello, all you fellow type 1s out there. This is Dr. Jody, and today I'm going to talk about a very common reason for highs that is often forgotten. Perhaps you're just finding me today. If so, welcome. Or perhaps you've been following me since I've been doing these Monday through Friday since the end of March. I came on when the COVID lockdown world that we live in now kind of began, and I really felt moved to be able to just share tips and inspiration to all of you living with type 1 for how we can stay healthy, get good blood sugar levels, and just inspire you with education and empowerment that we can have healthy lives. So I've had type 1 for 40 years. I did just eat lunch, so I am going up. So for all of you that ask, is my blood sugar always level perfect? Well, here it is, not perfect. I just had treated myself. I had some nachos. So I obviously didn't dose early enough. Hopefully I dosed enough, but obviously I didn't dose early enough because I had dosed early enough that I would have caught this peak, but I didn't. So once I hang up here, I'm going to go do a brisk walk around the block so I can get my insulin working and get that back down to near 100, which is where I like it. But so there you go. So I normally have pretty darn good sugar levels, as you guys have seen, for those of you that have been following me. I counted, this is my 76th Facebook Live in the past 3 months, April, May, June, now into July. So I've been coming to just bring tips. I've been doing a virtual practice with type 1s for almost 10 years now. I work with patients like you. I work basically with anybody struggling with blood sugar level roller coaster, which I mean, we all kind of do. I'm a little bit on the uprise right now. But my goal is to help anybody that's struggling get better education so you can feel empowered and get off that blood sugar roller coaster and get the best A1C of your life and feel great. So I also have a lot of courses on my website, and the link to have a call with me is there. So if you want to check that out, it's drjodynd.com. But today I want to talk about one of the many reasons why we can go high, but that we don't think about. And that is scar tissue. Okay. So if we're going to keep doing our pump in the same place or not rotating our shots enough, scar tissue is going to develop. It's just that's what's going to happen. So we must always make sure that we rotate. Some people have a chart, left leg, right arm, left arm. And then sometimes people make a chart for their pump, right? Pumps are even more likely to create scar tissue than shots because there's that presence of the infusion set for days, 2 days or 3 days, right? So there's a lot more opportunity. So I really encourage, especially all of you pumpers, to make sure that you're charting the location and that you're moving it around. There's even one doctor, Dr. Richard Bernstein, the classic type 1 diabetic who's had type 1 for over 70 years. He's in New York. He doesn't even want patients to be on a pump because he sees the scar tissue issue as such a problem. I'm more in the middle. I do see the benefits of pumps, obviously, even though I myself right now I'm on shots. I use a pen and I draw the insulin out with my needle. And for a reason I've explained in past videos. But I think there's enough benefits of the pumps that, that they're obviously good. I help lots of patients who are on pumps, but the scar tissue issue is really serious. If you're newly diagnosed, you're not even going to think about it. But if you're 5, 10 years plus in, you should definitely, you might already seen it. So what happens if you do a shot into a scar tissue area, it's not going to absorb very well. You're going to be high all day and you're wondering what happened. But then the next day you do the same amount and then you crash low and you think, what happened? I have brittle diabetes. Well, no, when there's scar tissue, it inhibits the max dose from being able to be absorbed. And so you have very irregular blood sugar levels, one of the many variables that is contributing to your roller coaster. Full absorption one day, partial absorption the next day, not good absorption the next day, back and forth. So one of the things I do recommend is if you do have scar tissue, or even after you do your shot, massage that area. Or when you take your infusion set out, massage that area. Bring good blood flow to that area, right? Scar tissue kind of is this binding, closed off tissue that then blood flow can't get into. And when you're giving yourself insulin, the insulin needs to get into the blood. That's where it does its job. So you really want to massage the area after you do your shot, after you take your infusion set out. If you already have scar tissue, get in the habit of really massaging these areas. I did have a patient once tell me that there is a topical that she used. I personally just heard about it. I haven't used it, but she recommended an all-purpose solve, which like is an herbal kind of like a, it's not a cream, it's not an oil, it's something in between. It comes in a little container. You can get a little bit on your fingers and then rub it. All-purpose solve. You get this at like a health food store with the herb Centella asiatica. I don't know if I'm saying that right, but I wrote it down. My handwriting is not great. But you can try putting this topically on your scar tissue. Give it a try. And if you try it, let me know if it works. Okay, I'll start collecting some data from you. All right, so massaging, bring more blood flow to the area. Try this solve. And make sure you're rotating your sites, rotating your shots, right? Because this is one of the many reasons for irregular, crazy blood sugar levels. Shot in the scar tissue, not, right? So I have a great course that's called How to Get Off the Blood Sugar Roller Coaster that can help you with all the many other reasons why you can be on the roller coaster. I also have one on why carb counting doesn't work, which teaches you how to really be able to dose your meals properly. And then, of course, master your blood sugar with exercise, because you should be able to learn how to exercise and not worry about lows. You don't have to eat. I used to stuff my face before working out because I was so afraid of lows. And you don't have to do that, people. So I missed yesterday. For those of you hardcore followers, I had a couple people say, where were you yesterday? I did take the day off kind of last minute. I got invited into a home out in the jungle. I'm living in Hawaii, and I literally was out in the jungle. So I had no cell service, clearly. And so I apologize for those of you that were looking for me yesterday. And like I said, I'm not going to do this forever, these daily Facebook Lives. I think I'll go to at least 100, which means like another 5 weeks. But I just thought I'd show you some crazy jungle pictures. Here's the drive that I took into where I was staying, and there were wild horses there. That was pretty cool. But yeah, it was a pretty amazing, lush, dense. So that's why I wasn't on my Facebook Live yesterday. We had to drive through the river to get to where we were going. This did give me the idea, by the way. Look at that amazing tree. Stunning. Of doing a type 1 diabetes retreat in Hawaii. So if you are interested, you should definitely go to my website and sign up for either the pop-up, the free handout, or I have free videos. I definitely need your email address so you can be notified of when I'm going to do that retreat next year. So if you want to do a cool adventure retreat with a bunch of type 1s in Hawaii next year, be sure to give me your email address, okay? So leave any comments, what you like, what you don't like. I'll be back tomorrow right around 3 o'clock Pacific, 6 o'clock Eastern, and maybe for a few more weeks. I don't know, but head over to drjodynd.com. You can sign up for the pop-up, even if you don't want it. Then I have your email address. You can sign up for my newsletter. I have that too, even though I'm not sending one right now. But I'd love to get your email address so we can stay in touch. All right. So thanks for watching today's video, and I'll see you tomorrow. Bye for now.